Hello there, and welcome to Dry Eye Girlfriend, the podcast where beauty, wellness, and science come together in the most eye-opening way. I'm Angela, your advocate, wellness enthusiast, and go-to girlfriend for all things dry eye. Sure, there's plenty of science and medical jargon out there, but where is the real talk? I created this show to raise awareness, share practical solutions, and bring you episodes with global experts, holistic health pros, industry insiders, and women just like you who are navigating the same journey. We talk about everything from nutrition and skincare to the most up-to-date science in dry eye. Because when we start connecting the dots between lifestyle and eye health, everything starts to get a whole lot clearer. Let's get into it. Today I have the absolute pleasure of welcoming Andrea Marczenko to the Dry Eye Girlfriend podcast. Andrea is not only a business owner and certified technician, but also an ocular hygienist who's passionate about bringing eye health and beauty together. She's built a reputation for both her experience and her heart, and I feel so lucky to call her a friend. In this conversation, we're going to dive into her journey, the role of ocular hygiene in patient care, and the ways that she's bridging beauty and eye health together. I know listeners are going to walk away with both practical takeaways and inspiration from her story. Andrea, welcome. I am so thrilled to have you here. I wanted to talk to you about how we met. Actually, you were put on my radar, I want to say over 2 years ago. My girlfriends know that I have a passion for dry eye, and they're like, have you heard of Andrea? She's an ocular hygienist, and I think that you should meet. So anyway, we actually met quite a couple of weeks ago at a women's networking event, and I feel like we've become fast friends ever since. We've gone for coffee, I've gone by your office, and so I'm so excited for everyone else to get to know you the way that I have. And yeah, today's going to be, I think, such a treat for everybody. So again, welcome to the podcast. I'm so excited.
Thank you so much. It's a pleasure to be here, and I'm excited, just as excited as you are, to talk about dry eye and all of those interesting things that people don't know about. And it's becoming such a mainstream thing. Dry eye itself is becoming a big problem. Like over 85% of the patients that we have come in have dry eye in some form. So we have treatment is really advanced and progressed, and it is astounding to me the way everything has evolved from a technology standpoint and just from a treatment standpoint. So,
Oh yeah. I think I had said when I started in the dry eye space, I was in the pharmaceutical side of things, and there was only one medication and nothing else. All the other modalities didn't exist. So we can talk a little bit more about that. But to start, can you tell us a little bit about yourself, about your journey into eye care specifically? Because from what I understand, you started in more of the aesthetic space and you're a business owner. So let's hear all about you. I'm so excited.
Sure. So it's interesting because my area of expertise is skin tightening and body contouring radiofrequency technology. I was actually approached by Dr. Patricia Fink. I've had my skin tightening clinic for 11 years, and she approached me because of the experience I had with radiofrequency, because I've been specializing in using that technology for so many years. And she approached me to ask me if I'd be interested in learning more about radiofrequency technology and how it can be applied to the dry eye space. So that is how I got involved, and I started working with her, and she was training me using medical aesthetics equipment to treat the symptoms of dry eye. So because I was already so familiar with radiofrequency technology, it was of course, I was super interested in learning more about how this can be applied to treat dry eye. So that is where the journey began. She got me involved, and I started working with her. She was training me, and then I became certified as an ocular hygienist.
Okay.
So, yeah.
And tell the listeners, what is an ocular hygienist? I think this is such a new space. Like I think it just came out a few years ago. And what is the role? What's the education? What's the role of ocular hygienist? All of that.
Right. So because I am a medical esthetician,
Mm-hmm.
that is the basic foundation that you need to become an ocular hygienist, unless you're being trained through your optometrist. So the interesting thing with ocular hygiene, basically the most of the training is done through your optometrist, and then your certification gets done. I was certified through the Dry Eye Summit in Toronto that happens
Okay.
every couple of years.
Yep.
So
Yep.
perfect timing for me because I was working with Dr. Fink for about a year before I went through that. And because of my experience, I have a lot of hours of experience with radio frequency technology, and then of course the training with her.
Mm-hmm.
Um, it was pretty straightforward getting the certification. But an ocular hygienist is similar to, we're very familiar with dental hygiene.
Mm-hmm.
Same idea, you're it's cleaning the teeth. It's the same idea with eyes. A hygienist, an ocular hygienist, is doing cleansing the eyelids, and it's all about,
Okay.
yeah. So the different things that I do in a day is basically I support the optometrist.
Okay.
So we're doing lid hygiene education. We do a lot of patient education. We are also doing diagnostic testing. So
Mm-hmm.
tear film analysis and mybography, which is an infrared diagnostic that helps to take a picture of the image of the meibomian glands. So those are the little glands that
Mm-hmm.
help release meibum, which is the little oil that helps your tears stick to your eyes and keep your eyes
Mm-hmm.
hydrated. So we're measuring all of these things. So the ocular hygienist does all of that support to help the optometrist determine how severe the dry eye is. And so we also do lid hygiene, lid scrubs, so ZocuClean, like these types of things.
Just for the listener, what is that? So they understand, like, if you're getting your eyes cleaned, what does that mean? What does that look like?
You're actually having a little eye shampoo. It's kind of like a
Okay.
little eye shampoo. You're relaxed on the table and we're
Mm-hmm.
basically cleansing. There's different steps and it's like a deep clean, like a
Mm.
little shampoo on the eyes.
Okay.
We're trying to remove all of the bacteria and all of these irritants that get into our eye and contribute to those dry eye symptoms.
Could someone do that at home, or is it important for them to at least go into the office, get one kind of good clean to start, and then maintain it?
Absolutely. We always recommend you come in and have a good clean, a good deep clean, and that can sort of set the foundation the same way you would if you were going to see your dentist to have your teeth
Mm-hmm.
cleaned, and then you're doing, the follow-up steps that involve that. So it's the same with ocular hygiene.
Mm-hmm.
We want you doing lid scrubs at home and just, hot compresses. We also offer things like, well, we recommend taking some supplements.
And what type of supplements do
So it'll
you
be like
recommend?
omega-3s
Yeah.
that help, those fatty acids help to support the eyes that way. Um,
Mm-hmm. The diet is so important, as we keep learning as well when it comes to
oh my
dry
goodness,
eye too.
there's so much support required for, like, what we're
Mm-hmm.
doing now is a whole comprehensive, we're looking into all aspects of your health that can
Mm-hmm.
to your lifestyle. It's very much a lifestyle based concern
Yep.
that people have, that the optometrist has, like what are you eating? It's systemic for sure now more than
Mm-hmm.
it's ever been, and that's definitely a huge part of the treatment process. Like we usually delve into a 90-minute consultation to investigate all of these different things that contribute to what might be causing your dry eye.
So when you go through this consultation, you get your eyes cleaned, where does radio frequency come in? Where does also IPL is something that I know you do as well. Where do those come in like the protocol? And what are those things for people that may
Right,
not know, and why I?
right. So
So
that's
much there.
yeah, that's a loaded one, but it's a great question because it is the future of the dry eye treatment. So we're using these actual medical aesthetics devices. So rate frequency energy is a warm massage that's applied to the whole periorbital area to help open up the meibomian glands, because those glands are blocked. 85% of dry eye is blocked meibomian glands. When we apply that heat energy to the eye area, we're opening up those glands. We're also, that radio frequency is remodeling collagen that also helps to support lengthening those glands, healing, repair to those glands. When we're remodeling that collagen, it's helping to repair the glands, basically.
I love that. It's
Yeah.
not just a band-aid treatment, it's actually getting to the core of the issue, right?
We're treating it from the inside out, which is why it's such a successful treatment, because you're getting that support. It's not, years ago for dry eye symptoms, you'd come in and see your optometrist, they'd throw some drops at you, away you go, we'll see you in a couple of months. But now it's so much more sophisticated, so much more advanced. The other component to that dry eye procedure is the IPL. So IPL is intense pulse light. And what that does, the second part of that, so we've got the radio frequency as the first part, the second part is IPL. So IPL helps to reduce inflammation. So the combination of those two components make up the dry eye procedure. And that is what is the magic solution to treating it from the inside out and reducing those symptoms. And
So
typical
what,
dry eye symptoms,
yeah.
I know, are just, some of them are pretty serious. Like it can almost feel like sand, like a sand-like feeling. That can be more like a blepharitis thing, which is, is a contributing factor to dry eye.
Even around blepharitis too, right? Like going to see an ocular hygienist, they can help you with your blepharitis. That basically, and correct me if I'm wrong, but is inflammation of the eyelids. And so
Yes.
all of these treatments sound like they would help with blepharitis as well, which contributes to dry eye. And so it's this cycle.
Mm-hmm.
The other thing I know when we were
Keeping the eye
talking,
clean,
yeah,
yeah.
yeah, exactly. And then maintaining it at home after. And we'll talk a little bit more about that too. I remember when we were talking initially around radio frequency when it comes to your lash health too.
Uh-huh.
And what are some things that people can expect that, are an added benefit to this treatment, not just to help with the dry eye component, but a beauty side of it?
Oh, well, in some cases, that is such a good question too, because I have so many before and after pictures of people that after they've been doing dry eye treatment, some patients actually experience lash growth because
Nice.
again, we're remodeling collagen along the entire lash line. So of course your eyelashes, not only are they going to be cleaner, healthier, support, keeping that area like restoring the health of your meibomian glands, but from a beauty standpoint, some patients actually experience lash growth. So
That's
their
awesome.
eyelashes will get really long. They'll start getting thick. It's almost like looking like they're using a lash serum. And of course, we discourage people from using these lash serums or being really careful what you use because there's a chemical in them called prostaglandin, which is a really big no-no. It's a major contributing factor to eye irritation,
Yeah.
causes
Yeah.
redness. Like there's a whole bunch of symptoms there of
I've
dangerous side
I've
effects.
had some bad reactions myself to prostaglandins, and there have been some lash serums, not all, but some that have basically prostaglandin analogs. So you don't recognize the name and it's a little bit
Right.
hidden. So and there's been other lash serum lines that have been taken off the market because they didn't disclose that they had a prostaglandin. So I think be very careful with those as well.
Mhm.
Definitely go with ones that are either recommended by your eye doctor or, has had a bit of research behind it to make sure that it says what it is. So good point for sure. And I love this idea of lash growth and thickening with radio
Naturally.
frequency. That's awesome. And then from an IPL perspective, it helps with inflammation. I've also heard that it helps with Demodex. That can
It
be a
does.
pesky
Yeah, the little mites,
parasite, basically.
critters. Lovely topic, right? Lovely.
Right? We
Yeah.
can't talk ocular hygiene without talking about Demodex. And just for the listeners, can you chat a little bit about Demodex and just how to combat that and, what to talk to your doctor about and what you may be experiencing and didn't know you had Demodex?
Uh-huh.
Again, lots of questions there.
Yeah, well, Demodex, they're little tiny microscopic mites, and they're
Mm.
kind of munching away on your dead skin. I mean, we all have some
Yep.
form, it's just an overproduction of them.
Yeah.
It's causing the inflammation. They contribute to inflammation, they contribute to irritation. Again, with good lid hygiene,
Mm-hmm.
that to start with, that will certainly help. The IPL helps kill them. That
Mm-hmm.
intense light energy going in helps to kill them and clear
Mm-hmm.
that area right out and just manage that because
Mm-hmm.
they've kind of gone out of control. I mean, we all, like I said, we all have some form of it on our skin, but when it's starting to cause that inflammation, that itching, redness,
Even those crusty eyes in the morning,
and the
that could
crusty eyes in
be,
the morning are a common symptom of Demodex. It can also be a common symptom of blepharitis too. Usually, a lot of those
mm,
go hand in hand. Like a
yeah.
lot of those patients have both.
So you definitely need an ocular hygienist in your life.
Absolutely. Come and see me because I can help you with this and you can definitely get some relief.
And I love that you have all of these other treatment strategies to help with that. So an initial clean and then, a radio frequency or IPL. So do you do those together? What does a protocol look like when it comes down to someone's treatment?
Everything is very customized, but generally speaking, we recommend doing those two components, the radio frequency with the IPL for the procedure. And we do it about once every 3 to 4 weeks. You'd come in and have that done. And we do up to three to four treatments.
Okay.
So it wouldn't take you that long. To really start to feel better for your
Mm.
eyes to get some relief from those pesky symptoms, the itch,
Mm-hmm.
watering, the crustiness that you see.
Yeah.
All of those are really typical. Some people have such severe dry eye that they involuntarily will start tearing. And you're always so confused when I say, actually, you've got dry eye, because they don't expect, if their eyes are just involuntarily watering, they're thinking, well, why is that? It can't be dry eye. You can't be telling me I have dry eye when my eyes are just watering. That's
Exactly. It's
actually
this.
severe dry eye. It's like
Mm-hmm.
an
Mm-hmm.
emergency response, the little gland, the acremal gland, if I'm saying that correctly. Yeah, it is like a hose on a burning house. It's like your body just goes into emergency response and just wants to put that fire out and give you some immediate relief. That's when you know you really have severe dry eye.
Because it comes down to not just tear production, but quality, like you were saying, right? Like you could have a lack of tears or too many tears, but then the quality of those tears as well may not have, let's say, those 3 layers that I know Dr. Maharaj talked about. And you want to make sure that you're optimizing that. And all of these treatment modalities help with that. The other thing I wanted to talk about, I love this idea with IPL because from a beauty perspective, there's so much benefit. If you want to walk everyone through that, plus a
Uh-huh.
rosacea sufferer like myself, what are
Uh-huh.
those benefits for those types of treatment too? I love this. I love that it has this duo outcome.
What a lot of people don't realize is when they're coming in for dry eye to treat their dry eye, the side effect, one of the beautiful, and it's just specifically an aesthetic side effect,
Mm,
is just a little bonus for the radio frequency. From the radio frequency standpoint, you are, because you're remodeling collagen around that delicate eye area, you're going to start to reduce fine lines. You're going to start to
love
reduce
that.
puffiness. You're going to firm that delicate skin and start to plump up that delicate skin. So
Mm,
not only are you going to start feeling better, you're going to start looking a lot better. IPL side of it, the intense pulse light, you mentioned rosacea.
mm-hmm.
Rosacea is a really, really common problem. It's just a triggering of the blood vessels that get triggered. It could be from heat, it could be from diet. And it's, again, you get that involuntary, all of a sudden your cheeks are red and you don't understand why. We
Mm-hmm.
really understand. We don't know what actually causes rosacea, but we can treat it and we can treat it really well. So the rosacea is inflammation. So
Mm-hmm.
it's encroaching on the eye area. So lots of times people that have regular rosacea also have ocular rosacea.
Yeah.
And of course, the ocular rosacea absolutely contributes to the dry eye problem.
Mm-hmm.
When we treat that, we treat right over the eyelids and the entire face, and
Nice.
you're reducing that inflammation. So your cheeks, you're going to have that nice, clear, angelic effect of not having the redness, which is beautiful from an aesthetic standpoint. And then you've also got, in some cases, the IPL, like if you happen to have some pigment damage, so in other words, some sunspots on your skin, and it's just kind of, or freckles, sunspots, anything like that, also magically gets treated when you're in having your dry eye treatment.
Love this.
And the
Yeah.
reason we treat your entire face for dry eye is because, again, the inflammation is coming from your face into your eyes. So when you need IPL, you likely need the entire face. So lots of just magic aesthetic benefits just from going in to do your dry eye treatment.
I love that. And you made me think. So I'm sure some of our listeners have had IPL or a radio frequency done. But again, you need to go to somebody that understands how to do it around the eye, because that eye area and you can probably explain this better, probably requires less or more energy and a different tool, even though it's still IPL or radio frequency. Can you explain that just so people know, oh, I should go see someone that specializes in eye care as well?
Right. So you're referring to the actual like customizing of the treatments? Is that what you're describing?
Like for instance, I've had radio frequency done. However, my provider didn't have, I think the product line is in mode, and they didn't have the crystal one that's specific to the eye area. And
Okay.
from what I understand, it's a different energy or different technique that
Yes.
they would use.
Right. So Lumeka, yes, you're absolutely right. Lumeka is the IPL handpiece that the company InMode makes, and that is the Health Canada indicated device.
That's
So
it.
that's the key thing,
Yeah.
that you can't just walk into, your local aesthetics provider who's offering IPL. Oh, well, I'm just going to go in and, get my IPL and hope my dry eye improves. It doesn't work like that. So we use a specific Health Canada indicated machine to ensure that we are getting optimal treatment specifically for dry eye. And it's specialized, actually, specifically the Lumeka has a sapphire crystal. The sapphire crystal, you kind of take everything that we love in general about IPL and take it up a notch, because a lot of notches actually, because it's state of the art. You don't experience any side effects like you traditionally would with a regular IPL. And
That's
it's
it.
also extremely quick.
I think that that's so key, especially if anyone has had IPL, they know, right? The other side of it. So this over your eye, is it painful? Do people experience any kind of pain, or is it relaxing? How do they feel during the treatment?
So with IPL specifically, it can feel like a little pinch on the skin. It's not going to hurt. Let's put it that way. You're going to feel it because you have to feel something to have a change happen on the skin, but it's not going to hurt. It's just going to feel like a bit of like there's something happening on the skin. Like you feel it. Some people describe it as like a little poke or a little pinch.
When I got it done, it almost feels like an elastic band,
Yeah, like a snap,
little
maybe. That's a
snappy,
good, actually, yeah, that's
little
actually a good
snappy.
way. A little snap, like a little tap. Let's
Yeah,
say tap. Let's
a
call it
little
a
tap.
tap.
I like that. I
Yeah,
like
let's
that.
call it a gentle tap.
No pain, no gain. That's what we're saying here.
Yeah, yeah. But actually, it doesn't hurt. It's not
No,
supposed to. It shouldn't
no.
hurt. We're applying the energy, and we want to make sure that something's happening there, because if you don't feel anything, then nothing is happening on your skin. So you have to at least feel that little tap on your skin. And then as far as afterward, there's no downtime. You
Yeah.
know, if anything, you might be a little bit rosy, a little bit pink, because you've had a treatment. You can see that you've had a treatment.
And that's from both IPL and RF?
The radio frequency side of it just feels like a warm massage. We apply that for, 5 to 7 minutes, and it just goes rolling back and forth across your skin in a gentle motion that
Nice.
just feels, it's just a relaxing. People describe it. I've had people fall asleep during the treatment. so
I want this
relaxing.
now.
Yeah. It honestly,
Um,
it might feel a little strange at first because like, oh wow, this is so strange. I'm having this warm sensation over my eye, but
mhm.
it actually is quite relaxing and quite comfortable. And
Yeah, like a spa, an eye spa. I
it
love that.
is. It is. It
Yeah,
really
yeah,
is. Yeah. By the time you come out of there, after you've had your, your lid hygiene, your scrub, your nice little shampoo, and your nice
yeah.
little, warm massage, and you're going to feel pretty darn good. I've had some patients tell me that their dry eye was 50% reduced, the symptoms
That's
following one
amazing.
procedure
Wow, after one.
after one.
Wow,
Now,
that's
that's not
amazing.
everybody, but I have had
Hmm.
patients tell me that. And that for me is one of the most rewarding things that I can hear somebody
I
tell
love
me.
that. It's
Yeah,
true.
there's
You
lots.
see it day in and day out. Yeah, people that are suffering with dry eye, it can be very debilitating. It can be such a quality of life issue, and this you're bringing, relief to people, and that's got to feel so good. That's got to
Oh
feel
my
great.
goodness, yes. There's countless stories I can tell you about people and success stories.
Yeah, I would love to hear, like, lastly, just going back to the procedure before we move
Yes, of
on.
course, of
I
course.
have seen it where it almost looks like a shield is in your eye. Is that
Uh-huh.
something that people can expect?
Yes. So when
Okay,
we're doing the IPL treatment over top of like right over top of your iris kind of thing.
yep,
We're treating the skin. We're treating the skin on your eyes, but we have to protect your eyeball.
of
So
course.
in order to do that, we put in a shield. It's like a metal shield that it's just gently placed inside your eye.
Mm-hmm.
I know that might sound a little bit daunting, but it's not bad at all. We have a lot of protocol in place to just make it comfortable so that it glides in easily and
Love
it's
that.
not in there for very long, but
Yep.
it does protect your eye. I mean, it's necessary because that light is so intense. We have to
Mm-hmm.
protect your eyeball, like the entire eyeball. I
Yep. Do you have to do that with radio frequency or just with the
know,
IPL?
just with the IPL. The
Okay.
radio frequency energy is, again, we are treating the skin. It's the skin that's irritated.
Mm-hmm. Mm-hmm.
So we just put all of these protocols in place to protect the skin. When we're doing radio frequency, we have an ultrasound gel that we apply over that periorbital area, and we're just giving us the ability to gently glide. So
Mm-hmm.
that's the extent of that. Your eyes are closed. You have this glide. We're rolling the handpiece along your eye back and forth, and it's warm, it's gentle, and it's relaxing. With the IPL side of it, yes, we do have to put the shield in place, but again, it's
Mm-hmm.
not in there for very long. It's
Yep.
just be fast, and you're in and out of there, and it's done. Then we cover we put a full shield on when we're doing your full face. So
Nice.
there's lots of
I think
safety. There's no danger whatsoever to your eyes
nice.
in this treatment. You're
And
going to
that I
get the
think that's
benefit.
key for people. You had mentioned this, but is there a patient or client that comes to mind that you were like, wow, I've had such an impact on their life, and this is something that, you can definitely feel rewarded about?
Yes, there's one client in particular who she had such a debilitating case of dry eye, and
Mm.
she actually had to be driven in to her
Oh.
appointments to have treatment done, and she she had, I believe it was a series of four. She ended up having an extra four or five dry eye procedures, and by the end of her procedures, she couldn't drive, and
Mm.
by the time she finished, she was actually able to drive.
That's
And that,
amazing.
yeah, so I mean, it's not only it's affecting your quality of life. These are your
Hmm.
eyes, and I
It's
mean,
everything.
it's
Yeah.
everything. It's so important.
Yeah. Yeah. And I
Yeah.
do find we take them for granted. I definitely am noticing them more as I'm getting older. And obviously, all these conversations we're having, it's so precious. And I think we need to give it the care it deserves.
Uh-huh.
And I love seeing all of these coming into play now. You know, you go see your eye doctor, you can basically go for an eye spa, see someone
Yeah.
like yourself, an ocular hygienist that understands that space. I'm curious to know, we talked about it a little bit, but what are the things that people can do at home after these beautiful treatments so that they can, you know, maintain the results?
Uh-huh.
You did mention things like lead wipes, but what would be like an evening and morning routine for someone? And if there's any products or just ideas of products that you would recommend, I think the listeners would benefit from that.
One of the key things that we like people to do is continue that nice little shampoo, and you can
Mm-hmm.
home. And so there's a product called Zocufoam.
I love it.
It's
Yep.
readily available. It really is.
Yep.
On most optometry clinics will carry that. And it's
Yep.
just a nice little shampoo. You just, massage it in, clean
Just
it.
with your finger.
Yeah, you can just do a nice little
Nice.
massage and give it a good rinse. And
Yep.
that's going to help really keep them clean.
Yep.
Uh, you can also do a brooder mask. So a brooder mask is like a little bean
Mm.
mask. It's
Yep.
a little, looks like little beanbag sunglasses.
Yep.
And just pop it in the microwave for, 10 or 12 seconds just to warm it up because the
Mm-hmm.
beads, retain the heat. And so then you
Nice.
can lay back and just rest those on your eyelids, get that heat flowing to help.
Would you say daily or, you
Oh,
know,
you can
as much as you can
absolutely
remember?
yeah, you can absolutely do that daily. It
Okay.
is just a really nice, it's like giving yourself like a little spa treatment at home, just like
Mm-hmm.
allowing that nice heat to rest on your eyes and giving your eyes a break.
Oh yeah, it feels amazing. It really does.
Yeah, yeah. So you know it well. You've been doing it.
Yeah. Oh
Yeah.
yeah. Yeah.
Mhm.
I also have another one that's a chargeable one. I got it for travel because you can charge it and it'll hold a charge. It's the Blink Joy one. I don't know if you've seen that. It's excellent.
Oh,
It's
you
excellent.
like that one, do you?
I
Okay.
do. I
No.
do. And they've got a few different products out. So, yeah, I've been trying that and I really enjoy that.
Yeah.
And then I also love, because it's easy, and I always love to give people like an easy lift,
Uh-huh.
hypochlorous acid, just
Mhm.
as my toner now. So I
Oh,
close
very
my
good.
eyes,
Yes.
spray a little bit of that.
Yeah.
I definitely use one that has the right concentration.
Yeah.
That's important. But I love that
Right. That's
because,
that's
you
perfect.
know,
Perfect.
it antimicrobial, all the things, but very gentle for daily use,
Uh,
right?
yeah. You can also use I think I touched on it earlier too, and just using the omega-3 supplement.
Definitely,
Yeah.
definitely.
Again, you're going through your gut is distributing that,
Hmm.
you know, support. You need a good quality product too. Like
Yeah.
your optometrist should have there's a number of different ones, but your
Hmm.
optometrist should be able to recommend something. I would avoid places like big box type, here it is on sale, here's your omega-3. They're not all built the same.
Yeah. I
Um,
think I need to do a whole episode on that just
You
for
probably could.
people. Yeah. There's
There's a
so much
lot of
around that.
out there.
Yeah.
They're definitely not all created the same.
Yeah. We've talked about this a few times, but I'm so interested to hear your perspective on, you know, what excites you the most where, you know, ocular hygiene and beauty is headed in the future. I know
Right.
that you've got a pulse on this. You're opening your own practice to do more of the aesthetic side of things, and we'll talk about that too. But what are the things that are exciting you the most right now? Just
Um,
again, 4 years ago, this didn't exist, and here we are.
I know there's so many crazy things. So, well, right now, I mean, we've got our energy-based treatments, and those
Hmm.
are going to just continue to get better and better and improve. And there's going to be better results, better outcomes. And we have our peptide-based topicals. So we have
Mm.
our skincare that helps to hydrate, repair, restore the eye area. So and the skin for that matter too.
Mm.
We're helping to support skin and manage things like rosacea. What I see happening in the future, and I'm hearing a little bit more about it too, are more systemic type things where we might be taking a peptide orally to
Okay,
support. Like there's all of these things that are coming out that
that's
may
exciting.
majorly change the face of aging in general.
Yeah.
certainly ocular health, because when we restore the skin on the cellular level and it's almost like reverse aging. Dry eye is typically associated with aging, but we're seeing it more and more in younger people as well.
Oh, yeah.
We're tackling the root cause of ocular dysfunction when we start to delve in deeper that way. And that's where I see the future of it going. It's not just symptoms, it's definitely what we have to restore it from the inside out.
That's a really good
You're going to
point.
see a lot more peptide-based things. They're talking about it now. Some celebrities are using that type of thing now. So I can't wait to see how exciting that's going to all evolve. But right now, the energy-based treatments are the best thing you can. It's the state of the art right now. It's like it's going to continue to evolve.
I love all the things that you're doing. You've really married, aesthetics and ocular hygiene into one. I'm just for the listener, before we go, how can people find you? What are you up to right now? And we'll leave on that note.
Oh, thank you. Yeah. So there's a new clinic open on Plains Road.
In Burlington, Ontario.
Yes, in Burlington, Ontario, on Plains Road. My company name is called Your Perfect Skin, and you can find me on Instagram at Your Perfect Skin, or yourperfectskin.ca. Reach out to me. I'm working with Dr. Patricia Fink at Patricia Fink Optometry. So I work there on Mondays and Thursdays and doing dry eye treatments. So if you have any questions, I welcome the opportunity to help, and please feel free to reach out. And I'm so very grateful, Angela, for this opportunity. You are wonderful to be doing this and educating people, because there are so many people out there that have no idea. Half the time when I meet people, they are telling me more. I had no idea this was an option. So you are a saint for bringing this forward and helping educate people by having, all of your wonderful guests that you have to help support this.
Well, thank you for being part of this journey. We're doing this all together, and it was the same thing. I kept hearing or talking to people about dry eye or these ideas around dry eye, and they had no idea. So here we are. We're gonna do this together. So thank you again so much for joining. I'm gonna put all of your contact information in the show notes so people can get in touch. I'm so excited for your next chapter, and I will definitely be coming in for some treatments. I cannot wait. And we can even do another episode after that happens to just, even talk about the procedure itself and all that fun stuff. So thank you again, Andrea.
How cool it was.
Yeah, how easy and how soothing and how spa-like. Exactly.
Good. Thank
you again. This is awesome. Thanks for tuning in to Dry Eye Girlfriend, where beauty, wellness, and science come together to support your eyes and your life. If today's episode helped you feel seen, gave you that aha moment, or just made you feel a little more understood, share it with a friend, subscribe, and leave a review. It helps more women find this space and feel less alone on their dry eye journey. Remember, dry eye isn't just something to deal with. It's something you can manage with the right support, smart choices, and a little girlfriend guidance. I'll be back soon with more real talk, expert tips, and conversations that keep your eyes and spirit feeling bright. See you next time.